This slideshow will introduce you to some important vocabulary words and concepts that you need to know when you are appraising studies of interventions. When learning something new, I think it's important to understand not only how to do something, but also why you're learning to do it. The easiest way I can teach you why we're learning to do what we're doing and how to do it is by providing a clinical example. The slide shows a picture of somebody named Nadine Jones. Nadine is your patient. She works as an elementary school teacher. She's 55 years of age and she's a little bit overweight, so she wanted to start a walking program. When she first started walking, she felt great for about a month. And then suddenly she had a progressively worsening ankle pain, and this ankle pain has been with her for the past 6 months. She was really enjoying walking. She was very active and walking with a group of friends, and she really hopes that physical therapy can help her keep up her walking activity. So she's coming to you to ask for help. To help Nadine, I'd like to suggest that you are where you are right now in the process of becoming a physical therapist. You are a first year, first semester student. My question is, can you help Nadine? Do you know enough to help Nadine? And the answer is at this point, probably not. But I can tell you with a little evidence-based practice, you can probably come up with some ideas that might help Nadine. So, evidence-based practice. If you remember back to the first class, we talked about the fact that there were 5 steps in evidence-based practice. Those 5 steps are listed here. And if you remember, I said that for the purpose of this semester, we're going to work on step number 3, appraising the quality of the research evidence. In order to do this, I need to give you the answers for step 1 and step 2, which I'll do on the following slides. First, step 1, you want to ask a searchable clinical question. That clinical question has been written for you here on this slide. And the question is, for a 55-year-old woman with worsening ankle pain, what therapeutic exercise regimen is most effective for improving pain-free walking ability? Again, we'll learn how to write searchable clinical questions next year in part 2 of this clinical inquiry course series. The next step in the 5-step evidence-based practice model is going to be searching for the best research evidence. I can tell you that you put in your clinical question, you search the PubMed database, which we'll learn more about next summer, and you found this article. This article is an article that I'm asking you have read by next class period, and the name of the article is Non-Surgical Management of Posterior Tendon Dysfunction with Orthosis and Resistive Exercise, a randomized control trial. Again, just go ahead and read the article for the next class period. We're going to work on appraising this particular article during the class period. Now, moving on to step 3 of the evidence-based practice model. We want to appraise the quality of the research evidence. This is what we're going to be doing all semester. We're going to be appraising lots of research evidence, looking at lots of ways to work with patients in your future. To do this, there's a total evidence appraisal form, and if I open that form of the evidence appraisal checklist, and this is the checklist in its entirety. Okay, filling out this, there's a clinical question, which we've talked about in the form that you're going to fill out in class, the following class period. The next class period is going to have the clinical question written in here for you. What you're actually going to go ahead and do in class is fill in the summary of key evidence, and all this information you can get from the abstract of the paper. Again, don't have to do anything now. We're all going to do this in a group during class time. The full article citation will be filled out for you. We'll talk more about AMA format later in the class. Next section, really important concept here, is known as external validity. External validity is just a Big vocabulary word that means, can the study results be applied to your patient in your clinical setting? You think external validity, think application. Will this study work for my patient? Is it a good fit for my patient? To examine the article's external validity, you're going to go through and answer these questions that are listed right here. Okay, there's a few things for external validity, or I think there's one thing for external validity we're going to talk about in a few slides, and that is, does my patient meet the inclusion and exclusion criteria? Okay, you don't know what that is yet, but you will in a few slides. But everything else that's listed here, I think you can understand without too much trouble. And if you have any trouble during class time, just feel free. I'll be right there, and you feel free to ask me questions, please. That's what this is all about. Okay, notice that on these forms you have bolded responses and not bolded responses. The bolded response means that if that is checked, if you've decided that the answer to that clinical question is a bolded response, okay, it's a better quality article than if the response was a non-bolded response. And again, external validity, more information on the form about internal validity. Another important vocabulary term. Internal validity, when you hear that term, you should think, was the study conducted with sufficient rigor that it can be used for making clinical decisions? In other words, was this a good study, or was it like the Manual Therapy Cures Death article that we talked about in the first class? Again, same format for the form. If the answer to the question is bolded, indicates a better quality article. So at the end of the appraisal form, you're going to see some summary statements. External validity. Can the results be applied to your patient in your clinical setting? Top threat. That's easy. Go back and look at the external validity section that you filled out. If the answer to the question was a non-bolded response, it's a possible threat, meaning that it might not be as applicable to your patient as you think it should be. Top strength. Look for things that are bolded, and then make some sort of judgment, some sort of statement, summary statement. Internal validity, same thing. Top two threats. Okay, what is not bolded? And is this non-bolded item potentially a threat to using this piece of evidence with my patient? Top two strengths. What is bolded? Okay, what's good about the article? And then eventually you're going to get a clinical bottom line for your clinical question, and then implications for practice. As I mentioned previously, this is the form in its entirety. We're just going to start with the very top of the form, and then we'll talk about the rest of the form during class. Okay, back to the PowerPoint presentation, or the slides presentation, and we're going to talk about some of the things that are covered under external validity and internal validity on the form that I just showed you that you might not know the meaning of quite yet. Okay, the first thing, as I mentioned, you're going to examine the external validity. And what does that mean? That means, is this Kulig 2009 study highly applicable to our clinical question about Nadine? So how do you examine the external validity of the article? Well, it's simple. You go back and you fill out that form that I was just showing you a minute ago. Here is a screenshot of the form, of the external validity portion of that form. And I have highlighted here, your client meets the inclusion and exclusion criteria. That's what we're going to talk about next. Now moving on to examining the internal validity of the study. The question that you're asking when you're looking at internal validity, is the Kulig 2009 study of sufficient quality to impact our care for Nadine? So how do you examine the internal validity? You just go back and fill out the form that I showed you at the beginning of the presentation. Here is a screenshot of the internal validity section for that form. And you can see I've highlighted participant recruitment in yellow. It's either prospective or retrospective, and what exactly does that mean as far as the study is concerned? The answer to that question is shown on this slide, where we're looking at prospective and retrospective and thinking about internal validity. As you can see here, a prospective study is less biased. It's less biased because it involves data collection in real time or live data collection. The study is actually designed before the patients ever receive treatment. In contrast to a prospective study, we have the retrospective study, which is at higher risk for bias and quality issues. Remember, internal validity is looking at the quality of the study. With a retrospective study, treatment has already been provided, but a therapist is going back and pulling select patients that they have treated in the past out for placing into the study. In other words, the study is designed after the patients actually receive treatment. And you can see why this might involve a higher risk for bias because the researcher is actually selecting patients, and they may only select patients for whom the treatment worked. Now, going back to our screenshot of the internal validity section on our appraisal form, you can see I've highlighted here participant selection. Was participant selection consecutive or selective? What exactly does that mean? The answer to that question is shown on this slide via a flow diagram. You can see in the left-hand portion of the slide, consecutive sampling, which is going to have less bias. You have patients that arrive at a clinic. All patients referred to the clinic after an ACL surgery were admitted into the study. The inclusion and exclusion criteria were applied to these patients, and this is the final study sample. So all patients is a consecutive sampling. Everybody that walked in the door is eligible for the study. Okay, selective sampling is shown on the right-hand portion of this slide. Selective sampling would be, an example of that would be orthopedic surgeons who were colleagues refer patients for a particular study. Any patient that they actually referred would have the inclusion and exclusion criteria applied to them, and this would be the final study sample. Now you can see that orthopedic surgeons in the selective sampling condition may have only selected patients for referral that had better outcomes. So the selective sampling is going to have more potential bias than a consecutive sampling. Back to our internal validity screenshot from the article appraisal form, you can see I've highlighted inclusion and exclusion criteria are well defined. Well, we talked about inclusion and exclusion criteria and what they were as far as external validity or applicability to your patient, but they're also part of the internal validity of the article. In this particular case, the internal external criteria should be very well defined. So you should be able to look at that criteria and look at a particular subject and decide whether or not they fit. And finally, one last set of terms you might not be familiar with on this internal validity section would be the words concurrent versus historical control or comparison for an RCT or cohort study. The difference between the concurrent versus a historical control is shown on this slide, where a concurrent control is a person or a subject who's enrolled at the same time as the person who's receiving the treatment, but they don't receive the treatment. A historical control is a subject who was treated in the past with whatever they're using as their control, not the intervention of treatment, but that person was selected as opposed to receiving the standard form of care at the same time that the study was being performed. You can see how a concurrent control would have less bias than a historical control.